Hi, everybody. It's Dr. Kerry Reller, your family and obesity board certified physician. I wanted to talk to you today about HDL cholesterol. I was going to do something different, but since it's actually September 2022, it is Cholesterol Awareness Month. So I figure we would just stay on this topic. Okay, so let me share my screen. Okay, so today, how to increase your good HDL cholesterol. Okay, so a couple of these are repeated, but most of this presentation is new, so please bear with me. But why do we care about cholesterol? So basically, cholesterol is a fat substance in your blood that it joins with other substances and it can build up on the inner walls of your arteries. Then these arteries become clogged and narrow, and then when they're narrowed, the blood flow is reduced. That reduced blood flow to the arteries to your heart can cause chest pain. And if it's so reduced that there's either a completely clogged artery or a blood clot clicks off, then a heart attack can occur. The same thing can happen with the arteries to your brain, and that results in a stroke. Also, I presented this before, but why is fat important? So fat is an important thing in the body because it's a major storage form of energy. It's important in immune function, cell membranes, brain tissue, hormone synthesis like testosterone and estrogen, vitamin D synthesis, and bile acid synthesis. It is actually necessary, you need fat to absorb vitamins A, D, E, and K. Those are the fat-soluble vitamins. And essential fats like omega-3 and omega-6 are important for heart health, and we can't get those from that. Our body can't make them. We have to eat them in order to get those omega-3 and omega-6 fats. Healthy fat can help lower the LDL. We're going to talk about that. And it also adds flavor to food, and fat is important because it also keeps you satisfied longer after a meal. So some statistics from the American Heart Association and the whole September 2022 Cholesterol Awareness Month are presented here. So high cholesterol is a major risk factor for heart disease, which is the leading cause of death in the United States. People with high cholesterol is twice as likely to have heart disease than people with low cholesterol levels. 73.5 million American adults have high LDL, or the bad cholesterol, but fewer than 1 out of every 3 adults with high LDL has the condition under control. So that's why they're having National Cholesterol Awareness Month, and we're bringing this information to you today. So why do we care about the HDL, that high density lipoprotein? So it is, first of all, the normal numbers for a male, higher than 40 is considered normal from a lab value, and for a female, higher than 50. Okay, for low levels, anything under that. There is an inverse relationship between the HDL cholesterol and the risk of an atherosclerotic cardiovascular event. So that means that low HDL is more likely to have a heart attack or a stroke. So it hasn't proven to be a causal relationship, but this is likely because one of those things that I described earlier before was that the LDL is the bad one that sticks to the arteries, but that HDL takes those bad LDL particles and recycles them to the liver to get rid of them. So the more HDL you have, the better your LDL can be. So some causes of low HDL cholesterol, most are actually inherited. Other causes can be from drugs such as beta blockers. If you're on metoprolol, that's a common one, or benzodiazepines. Some people use those for sleep aids or for anxiety, and also anabolic steroids like testosterone replacement. Acute infection or inflammation or a blood disorder called gammopathy can also cause low HDL, and insulin resistance as well. And I'll do a presentation later on insulin resistance, so please look out for that. That's basically diabetes or prediabetes. Okay, so will increasing your HDL make you have less risk of heart attack or stroke? So like I said, there isn't direct causal evidence that increasing that HDL without decreasing the LDL can improve those risks. So most studies and trials do focus on lowering the LDL. So certain medications can actually help raise the HDL. So one is niacin, which we don't use much because there's a really strong side effect of flushing, like red face, that is really bothersome to patients. So we don't usually use that. Gemfibrozil, often used for elevated triglycerides, is another one that can help raise the HDL, and also estrogen replacement therapy. However, just to raise the HDL, we don't actually use these medications because there's no proven cardiovascular benefit. So we're not just working the number here, we're working the whole patient involved too, and don't want to do any harm. So how do we approach a low HDL cholesterol? So these are the same kind of things that we talked about with lowering the LDL, right? You want regular exercise, you want to be able to move more, you want to definitely stop smoking if you're smoking, and attaining a target body weight. So even losing 3 to 5% of your weight can increase the HDL. So that's not an unattainable goal, right? Also just a general, a healthy diet, lots of fruits and vegetables, but in focus, what we're going to discuss here is replacing those saturated fats with unsaturated fats, or being monounsaturated or preferably polyunsaturated, and avoiding those trans-saturated fats like we discussed last time. So which fat is which? I did discuss this last time, but first of all, you want to avoid those trans-saturated fats. Those come from processed, commercially prepared foods like cupcakes, cakes, bakery goods, usually anything that you can find in that class, hot dogs or anything like that. Also, you want to reduce or limit the saturated fat. So those are found in animal foods. And then you want to eat more unsaturated fat. Those are the plant foods. Okay. So animal foods, you know, beef, pork, anything with the gristle on it, other animal products as well. And then the plant ones, we're going to go into more detail. So those unsaturated fats, the good ones that we want you to consume more of, to bring up that HDL. Those are those healthy plant-based oils like the safflower, sunflower, corn oils, canola, soybean, flaxseed, olive, and walnut oils. There's even avocado oil now. Nuts, seeds, avocados are great sources of unsaturated fat to bring up that HDL. Wheat germ, cabbages, vegetables of the cabbage family are very good. Then that fatty fish, I always tell people, you know, basically I say salmon, avocado, nuts, seeds, you know, those are great things to bring up that HDL. And then lean meat, and like I discussed last time, the dairy products are controversial. And then overall decreasing those saturated fats and avoiding the trans-saturated fats. We still want to focus on that too. So limiting red meat and processed meats to maybe once or less times per week, and limiting those saturated coconut, palm, and palm kernel oils, and definitely avoiding partially hydrogenated vegetable oil, and baked goods, cookies, cakes, fast and fried food, or all have a lot of trans-saturated fats. You want to avoid that as well. So if you look at a nutrition label like this one here, this one doesn't have the breakdown of the unsaturated fats, but you can see that it has the total fat, and then it has the saturated fat, 1 gram, which is 5% of a 2,000 calorie daily value, and it had 0 trans fats. So in 2015, the government made it, you know, a rule that you could not include trans fats in your foods, and they actually have to be obviously on the label as well. The unsaturated fats don't have to be listed on the label, but you can calculate it here, right? So if there's 1 gram of saturated fats, then in this food, you're getting 7 grams of the unsaturated fat. Just taking the total fat, 8 grams, minus the saturated fat, 1 gram. The rest left over would be the unsaturated fat. So these are some of the most excellent sources for raising your HDL. salmon, one of my favorite, avocados, pecans, other nuts. And then you can see here, there's also a fish oil supplement there. So a couple things about the fish oil. So it doesn't necessarily directly increase the HDL. I still recommend it for other reasons, even for cognitive health, immune health. It can be a good supplement. There are some complaints, I'm sorry, that some people, if it makes you burp, and then it will give that fishy burp taste. So I often recommend either getting the burpless type that exists in some pharmacies or health food stores, or a patient told me that when they freeze it, then they don't have that symptom. So they actually freeze their fish oil capsules and will take it, and they don't have that side effect. So you could think about doing that too. The only thing, obviously, downside of that is not like in your pill box or anything. So it's not as handy to remember to actually take it. So I mentioned this before, but don't restrict fat. It's good for you. Just choose the better fat. So take that saturated fat and replace it with the unsaturated, right? So limiting processed red meats, eating the unprocessed red meats in moderation, up to 1 or 2 portions per week, limiting those ultra processed foods rich in refined starch, added sugar, trans fats, and or sodium. So those are the ones that definitely, if you can limit, that would be very beneficial in all areas of your health. And then eat more foods rich in healthful fats, vitamins, flavonols, and other bioactive compounds, such as the nuts, seeds, plant oils, fish, fruits, non-starchy vegetables, legumes, and minimally processed whole grain products. So don't assume, I mentioned this before in the other one, but don't assume that the low fat or fat-free packaged processed foods are any better or more healthful or even better for weight control than their full fat counterparts, right? So there used to be those Snackwell low fat products, and they really were not necessarily helpful for weight loss or reduction overall. Basically, they took out all the fat and kind of left not much flavor, but remember, the fat helps you feel full. So you would eat those products and then pretty much be hungry really shortly after. So when fats are needed for cooking, spreads and dressings and other uses, try to use the plant oils, including the extra virgin olive oil, soybean, and canola oil. Those are definitely better for the cholesterol profile. Now, I'm not really talking exactly about weight loss here, just improving cholesterol. Please keep that in mind. So anyway, these are my references. The heart.org is the focus of the September Cholesterol Awareness Month. So you can find a lot of resources there. And I will be posting some links to some things on social media this week too, or this month. And if you have any other questions, please, reach out, try to find me on social media, Instagram under Clearwater Family Medicine, Facebook under Kerry Reller or Clearwater Family Medicine and Allergy business page, YouTube Kerry Reller, and, come work with us. Our website is www.cfma.health or just my name, kerryrellermd.com. I hope to hear from all of you soon, and thank you so much for watching. Have a great day.